Well, so much strain on our hospitals begs the question, how do you have a baby during the peak of a pandemic? Not only are the rules around birthing in hospital changing, there's still a lot of uncertainty about potential in utero transmission from mother to unborn baby. Well, to tell us more about what mums-to-be can expect, I'm joined now by Dr Shastra Bhoora, head of the COVID team for obstetrics and gynecology. Doctor, thank you so much for joining us. So much pressure on our hospitals, as that report has indicated. We are heading for the peak of the pandemic in the next 2 months. What are the rules for a woman who wants to birth naturally in hospital?
Well, good evening, Sally, and to the rest of the country, and thank you for having me. I think that is a very important question to ask to mitigate any anxiety that a pregnant mother is experiencing through this pandemic. The rules are the guidance we have. We are guided by national as well as international medical societies and boards. We have the South African Obstetric Societies of Obstetrics and Gynecology, as well as our clinical governance committees. And essentially, we are all trying our absolute best to make this experience for the mother and the baby units an experience that is favorable, that is pleasant, that is still exciting, even though it falls under the umbrella of this pandemic. The rules apply to a pregnant woman like they do to the rest of the country: wearing of masks, good hand sanitization, keeping distances from other individuals who potentially can be infected to protect themselves. From a delivery point of view, we do not routinely induce these patients to have their babies. We basically review every case by case on an individual basis, and any woman who is in labor is attended to as an acute emergency and gets the care and the need that she requires for that labor and the delivery.
Okay, that's interesting that there are no specific rules, because I would imagine that perhaps then certain private hospitals have got different rules in place. I've heard from people, for example, that you have to have a COVID test, mother and father, 3 days before your due date, so that you know you're COVID negative. And that if you want to birth naturally in some hospitals, they're suggesting strongly that you are induced, so they know exactly when you're coming in. And this is also to make sure there are beds available for women. So in terms of advice to a mum-to-be, is it perhaps wise to consider being induced or even an elective Caesar, so that you know when you're going in, you know what to expect, and you know a bed has been reserved for you?
So I think when we're looking at birthing choices and decisions that need to be made in a pregnancy, the guidance that has been given is not to change anything that would have happened outside of COVID. So if the decision at the beginning of the pregnancy for that couple was to deliver normally, was to have a hospital birth, or was to have a cesarean section for the delivery of that baby, COVID shouldn't really change that plan that was set at the beginning of the pregnancy. In terms of evaluating risk mitigation from an infection point of view, it is wise to be able to know the status of the patients we are treating, as well as the partners being exposed to the birthing process. And I say that from a point of view of protection of the baby mother unit as well as the healthcare worker, so that the correct preparation can be put into place to optimize safe practice and best practice principles for the delivery of that mother and the baby. When it comes to inducing, I would suggest that the induction criteria is based purely on obstetric or fetal indications. There are schools of thought that low-risk pregnancies, there have been good outcomes at inducing pregnancies at 39 weeks to reduce cesarean section rates. I would not advise that COVID disease would dictate that a mother needed to deliver via cesarean section, as that comes with a whole other profile of risk factors, and danger to the mother and the baby.
If, let's say, so you're advising that it's probably a good idea to know if you're COVID negative or positive before you go into hospital. So possibly seeking a test a few days before your due date. Let's say you test positive. You still have to give birth. What is going to happen in a hospital? How differently are you going to be treated? I've heard reports that the nurses won't go near you if you're positive. You're basically going to be left mostly alone because they're going to try and minimize contact, bearing in mind the whole unit could be at risk. What is the protocol if you're pregnant and you're COVID positive and you're going into hospital?
I can confidently say that if you are COVID positive, that you will get all the attention that is required for you in that labor. In the facility that I work in, I really truly commend the midwives that look after patients who don't always have a partner to be with them through the birthing process. So the fear is there, I think, not only for a healthcare worker, but for all of us as a country in terms of the uncertainty of what COVID holds for us. But the precautions are taken. The correct PPE is used to approach a mother who is COVID positive. There's even been guidance in terms of putting up a screen during the birthing process, if it is a normal vaginal delivery, to protect the mother from the healthcare worker and to protect the healthcare worker and the newborn baby from any droplets that may be produced from the maternal side during the effort during labor. So the guidance has been to protect healthcare worker and baby mother units, and it's always good to know the status, because then those precautions become foolproof and we basically know everything that needs to be done to make certain that the woman, the mother, the baby is well cared for and that it is a safe delivery process.
Doctor.
And the experience, like I had mentioned earlier,
Yes.
is still one of joy and of great happiness.
So, doctor, if a mum is positive and she goes in to have her baby, is she able to breastfeed? Is it advised that she breastfeed? Is it allowed that she can hold her baby? Or is there a risk that she could give her baby COVID-19?
So I think if we follow the basic principles of a mask to prevent droplets from reaching to the baby that the mum wears, and good hand hygiene before handling the baby as well as after, then we definitely advocate for breastfeeding and for having that newborn baby close to the maternal love and the warmth.
Can COVID-19 be passed through the breast milk? Do we know?
We are not certain of that at the moment. There have been tests that have been done that hasn't picked up a viral load in breast milk to confidently determine that there is a transmission via breast milk to the baby. There have been some recent reports and case reviews that was published recently out of a hospital in a university of Paris that looked at placental transmission, and they looked at immunohistochemical testing as well as inflammation and clot formation in the placenta of a positive mother versus placentae of mothers who were negative, and found there were differences. So there is some suggestion to suggest there could be vertical transmission via the placenta. It is only a case series of one patient that was investigated, and we do wait for more information and basically more significance of transmission via the placenta to the baby. So that would be one, error that we are basically evaluating more into depth. As far as I am aware at the moment, breast milk has not been confirmed to be a risk to the baby. It has, however, shown to have huge benefits in terms of the baby's immunity and well-being.
Well, thank you very much for your guidance this evening. Dr. Shastra Bhoora, head of the COVID team for obstetrics and gynecology.